let's dive into the different types of ringworm infections and their specific characteristics and symptoms. Ringworm is a common fungal infection that affects the skin, hair, and nails. It's caused by a group of fungi called dermatophytes, which thrive in warm, moist environments. There are four main types of ringworm infections: tinea corporis, tinea capitis, tinea pedis, and tinea cruris. First up is tinea corporis, which refers to ringworm infections on the body. This type of infection usually appears as a red, scaly, circular rash with a raised, clear center. It's often itchy and can sometimes be mistaken for eczema or other skin conditions. The name ringworm comes from the ring-like appearance of this rash. Next, we have tinea capitis, which is a ringworm infection that affects the scalp. This type of infection can cause red, scaly, and itchy patches on the scalp, as well as hair breakage and hair loss in the affected areas. In some cases, tinea capitis can also lead to the formation of a painful, pus-filled bump called a chirium. Moving on to tinea pedis, more commonly known as athlete's foot. This type of ringworm infection affects the feet, particularly in the spaces between the toes. It's characterized by red, scaly, and itchy skin, sometimes accompanied by a stinging or burning sensation. In severe cases, the skin can become cracked and prone to secondary bacterial infections. Lastly, we have tinea cruris, also known as jock itch. This ringworm infection occurs in the groin area and is characterized by red, itchy, and scaly skin, often with a welt. The rash can spread to the inner thighs and buttocks, and sometimes even the abdominal area. So those are the four main types of ringworm infections, each with their own unique characteristics and symptoms. It's essential to know the differences between them, as this will help you identify the infection and seek appropriate treatment. Now that we've discussed the various types of ringworm infections, let's focus on how ringworm spreads. Understanding how it spreads is crucial in preventing and controlling the infection. Ringworm can spread in several ways, including direct contact with an infected person, animal, or contaminated objects. Additionally, certain environmental conditions can promote fungal growth, making it easier for the infection to spread. Symptoms. First, let's talk about direct contact. Ringworm can spread from person to person through skin-to-skin contact with an infected individual. This can happen during activities like sports, especially wrestling, where close contact is common. It's important to note that not everyone who comes into contact with a fungus will develop an infection, as factors like personal hygiene and immune system strength play a role in susceptibility. Ringworm can also spread through contact with infected animals, particularly cats and dogs. In fact, some animals can be carriers of the fungus without showing any symptoms themselves. Petting or grooming an infected animal can lead to the transmission of the fungus to your skin. Contaminated objects are another source of ringworm transmission. The fungi can survive on surfaces like towels, clothing, bedding, combs, and brushes, as well as in communal areas like locker rooms and showers. Touching these objects and then touching your skin can transfer the fungus and potentially cause an infection. Environmental conditions can also contribute to the spread of ringworm. Dermatophytes, the fungi responsible for ringworm, thrive in warm, moist environments. This is why infections like athlete's foot are common in individuals who frequently wear damp or slay shoes and socks. In summary, ringworm spreads through direct contact with infected individuals, animals, or contaminated objects, and certain environmental conditions can promote fungal growth. Being aware of these transmission methods is key to preventing and controlling ringworm infections. Now that we've covered the types of ringworm infections and how they spread, let's discuss the various treatment options available. Treating ringworm effectively is essential to prevent complications and ensure a speedy recovery. There are several methods to treat ringworm, including over-the-counter antifungal creams, prescription medications, and proper hygiene practices. Firstly, let's talk about over-the-counter antifungal creams. These creams are usually the first line of treatment for ringworm infections, especially for mild to moderate cases. They contain active ingredients like clotrimazole, miconazole, or terbinafine, which help eliminate the fungus responsible for the infection. It's essential to follow the instructions on the product label and apply the cream consistently for the recommended duration, usually 2 to 4 weeks, even if the symptoms improve before that time. In some cases, especially for more severe or persistent infections, prescription medications may be necessary. These medications can be topical or oral, depending on the severity and location of the infection. Your healthcare provider will determine the best course of treatment based on your specific situation. It's crucial to follow your doctor's instructions and complete the entire course of medication, even if your symptoms improve before finishing the treatment. Proper hygiene practices play a significant role in treating and preventing ringworm infections. Keeping the affected area clean and dry is essential to create an environment that's less conducive to fungal growth. Gently wash the area with soap and water daily and pat it dry with a clean towel. Avoid using the same towel on other parts of your body to prevent the spread of the infection. Additionally, it's important to avoid scratching the infected area, as this can cause the infection to spread to other parts of your body or lead to secondary bacterial infections. If you find it challenging to resist scratching, consider covering the area with a bandage or wearing gloves at night. In summary, treatment options for ringworm include over-the-counter antifungal creams, prescription medications, and proper hygiene practices. It's essential to follow the recommended treatment plan and maintain good hygiene to ensure a successful recovery and prevent the infection from spreading or recurring. Now that we've covered the types of ringworm infections, how they spread, and the treatment options available, let's focus on preventive measures to avoid ringworm infections. By taking these precautions, you can significantly reduce your risk of developing a ringworm infection or spreading it to others. First and foremost, regular hand washing is crucial in preventing the spread of many infections, including ringworm. Make sure to wash your hands thoroughly with soap and water, especially after touching animals or handling objects that might be contaminated with the fungus. Keeping your skin clean and dry is another essential preventive measure, since the fungi responsible for ringworm thrive in warm, moist environments. Maintaining clean and dry skin can help deter fungal growth. Pay special attention to areas prone to moisture, such as the feet and groin area, by drying them thoroughly after bathing and using moisture-absorbing powders if necessary. Next, avoid sharing personal items like towels, clothing, combs, and brushes, as these items can harbor the fungus and transmit it from person to person. If you're using shared facilities like locker rooms or communal showers, it's a good idea to wear sandals or flip-flops to reduce your risk of contracting a fungal infection. Wearing appropriate clothing in public spaces, especially in places where you may come into contact with fungus, can also help prevent ringworm infections. Choose breathable, moisture-wicking fabrics like cotton or synthetic materials designed to keep you dry. Additionally, avoid wearing tight or restrictive clothing that can create a warm, moist environment for the fungus to thrive. In summary, some of the key preventive measures to avoid ringworm infections include regular hand washing, keeping skin clean and dry, not sharing personal items, and wearing appropriate clothing in public spaces. By following these guidelines, you can help reduce your risk of developing a ringworm infection and ensure the health of your skin. Lastly, let's discuss the potential complications of untreated ringworm infections and why early diagnosis and treatment are so important. While ringworm is generally not a serious condition, Leaving it untreated can lead to a variety of complications, some of which can be more severe or challenging to manage. One possible complication of untreated ringworm is the development of secondary bacterial infections. When you scratch the affected area, you can create small breaks in the skin, which can allow bacteria to enter and cause an infection. These bacterial infections can be painful and may require additional treatment with antibiotics. Hair loss is another potential complication, particularly in cases of tinea capitis, which affects the scalp. The fungal infection can damage hair follicles, leading to hair breakage, and in some cases, permanent hair loss if left untreated for an extended period. Untreated ringworm infections can also spread to other parts of the body, resulting in a more widespread infection. This can be particularly concerning for individuals with weakened immune systems, as the infection may be more difficult to treat and control. Early diagnosis and treatment are crucial in preventing these complications and ensuring a quick recovery. If you suspect you have a ringworm infection, it's essential to consult a healthcare professional for an accurate diagnosis and appropriate treatment plan. By addressing the infection promptly, you can help minimize the risk of complications and prevent the spread of the fungus to others. In conclusion, untreated ringworm infections can lead to potential complications such as secondary bacterial infections, hair loss, and widespread infection. Recognizing the importance of early diagnosis and treatment is crucial in managing ringworm effectively and maintaining the overall health of your skin.